everyone. I'm Megan Cullup, along here with Scott Michlin.
Good morning. It's Thursday, February 18th, 2021.
Yeah.
Welcome, everybody.
Week 49.
49. Wow.
I know.
Really?
Yeah.
Yeah, that probably is about right, isn't it?
I think that's true.
Yikes. Okay, Here we go. Anyway, we're glad that you're with us, everybody. Welcome. This is the KSJE COVID-19 Community Information Program, and we have a lot of great guests and information lined up this morning. We're going to be talking with Jeff Bourgeois from the hospital, San Regional Medical Center, of course. We'll get an update from him. There's a couple of things we're going to talk with him about this morning. Then Sandra Eli is going to be talking with us. She is with the New Mexico Environment Department about the COVID-19 watch list. Tina Pacheco-White from the First Tee is going to be talking with us about their program to get student golfers back on the course once the snow melts. So we're looking forward to that. And then Devin Neeley will be calling in as well to talk a little bit about the COVID yellow or red to green map that caused so much controversy last week. So anyway, that's the show.
It was controversial, wasn't it?
It was controversial, yeah. So we'll talk more about that coming up. But that's what's coming up this hour. So we're glad that you are with us. Let us go to the phones this morning for our first guest who is standing by. Good morning. You're on KSJE this morning. Thanks for calling in.
Hi, good morning, Scott. This is Jeff Bourgeois.
Hi, Jeff Bourgeois. We're glad that you're with us again this week. Thank you very much for calling in. We kind of wanted to talk with you a little bit about the current conditions at the hospital, and I'm thinking that numbers are certainly lower than they certainly have been a month or so ago, right?
Oh, you bet. They're the lowest, Scott, that they've been in quite a while since way back in October when this second surge started. Today, we actually have only 28 confirmed positive inpatients in the hospital, and as of 6 o'clock this morning, there were 7 additional patients, still pending a test result. So that's very low compared to what we had seen, again in the peak of this second wave last month and the month before. So very encouraged by that downward trend, in the need for hospitalization of COVID patients locally.
That's great. And it was my understanding that the 4th and 5th floor were designated COVID floors. Do we have a specific census there? How is the ICU doing?
Okay, Megan, let me get back to our report there. So, yes, the 5th floor was, something that we converted as part of our response to this second wave. We did not need to do that the first go-round. Because we were able to handle the COVID census back then on the 4th floor exclusively. So let me get back to another document here, if you would bear with me.
No problem, Jeff. Thank you very much for checking for us.
We let's see. Here we go. Okay, so one thing that hospitals everywhere have continued to see is the how the demand is for non-COVID ICU beds. So we are still seeing quite a bit of that. So that ICU is on our 3rd floor, and I believe as of this morning, all 9 of those beds are full, and that is really something to I think call out and make sure that everyone, here we go, I'm going to get today's numbers. Everyone pays attention to what their current healthcare needs are and not delay care. So, we still have a higher than average ICU census combined between the two at 18. Now, we have 23 beds, so we have capacity. But the non-COVID ICU is full, and often that we're seeing patients who have delayed seeking care coming in with a sicker presentation, if you will, than if they had presented earlier. So, and then, Megan, back to your question, our COVID ICU has 9 patients in it, and then on the 4th floor, we have, outside of the ICU, we have 20 COVID patients, and then only 5 up on that 5th floor. So a greatly reduced census for COVID-specific patients.
Indeed. Well, Thank you, Jeff Bourgeois, for finding out that information for us. And I just want our listeners to know that we're going to be visiting with you when conditions warrant. So it won't be maybe every week moving forward, because we're grateful that the numbers are down and that you don't need to be on the show every week. But you're certainly always welcome to call in and be a part of the show. But I just wanted everyone to know that since numbers are coming down, and we're so grateful that we will be speaking with you maybe a bit less and less unless things change dramatically. So we appreciate all your efforts over the last few months, Jeff Bourgeois, very much.
We know that you're going to miss us.
Yeah, well, we are so appreciative of the fact that you have provided this venue for us to keep the community updated. It's been valuable to us, and we appreciate that.
Well, you're welcome.
Did you want to know anything about the monoclonal antibody clinic we have available?
Yes, please.
We did want to ask you a little bit about that, because there were some changes in some of the criteria, I think, for some of the patients who are eligible for treatment. This is another one of the treatment options for patients who do have COVID-19 positive test results, right?
That's right. And it's really interesting. And in a couple of studies that have been done, it has proven to reduce the frequency of or the need for hospitalization, as well as the mortality rate in certain high-risk populations compared to the placebo in these controlled studies. So it's really encouraging, and again, it's for patients that are at risk for having a more severe course of illness than others. So that really includes anybody over age 65. It includes persons between 55 and 64 who have, a long list of underlying health conditions, any one of the following: of a cardiovascular disease, hypertension, COPD or other chronic respiratory disease, a body mass index of greater than 35, that's a measure of obesity, chronic kidney disease, diabetes, or some sort of immunosuppressive disease, or be receiving immunosuppressive therapy. So those patients also qualify. In addition, younger patients from 18 to 54 who have that body mass index greater than 35, chronic kidney disease, diabetes, or the immunosuppressive disease or therapy ongoing, now all qualify. And there are certain other clinical circumstances. The treatment must be within 10 days of onset of symptoms, and that their current course of disease is not requiring hospitalization or oxygen support. It's a one-time outpatient infusion therapy session that lasts approximately an hour. And so we encourage people, we've shared this with our physicians, and then in the community, and then we've shared this with the public via our social media platforms. We also have that news release that we published, I think just yesterday maybe, is now available on our website as well. So it's been really amazing to see how quickly the medical and scientific community has been able to respond to this novel disease that hardly less than a year ago was something we knew anything about. The vaccines being as widely available as they are now, and these types of therapies to help combat people with active course of illness, it's just truly amazing how quickly the scientific, again, and medical community have researched and brought therapies and vaccinations to the general public. So we're happy to be able to participate in that here, and again, encourage people to talk to their physician if they think they may be eligible to receive that type of therapy.
Absolutely. Now let's talk visitor policy. This has been something that I know has been very, very difficult for a lot of people. We saw a press release recently that there's been some changes there, so can you give us an update on that?
Yes, thank you, Megan. And and this has been difficult not only for the patients and their family members, but also our caregivers. We truly appreciate the importance of family members and loved ones as part of the healing process. And the circumstances that COVID had created, it was pretty much a universal response by hospitals to have greatly restricted visitor policies throughout this pandemic. So now, as our numbers have subsided, we are now returning to allowing visitors on the non-COVID floor. Still somewhat restricted, though. So one visitor per day between the hours of 8 a.m. and 4 p.m. We ask that they be older than 18, and then we still have to do a health screening when they enter the hospital. One of the things that's changed is there are no travel-related restrictions for visitors, but they still have to come in and pass the screening. So, and that's really important for us, as many people have relatives that live out of state and might want to travel to Farmington to visit a hospitalized family member. So that's a change also. We continue to have our no visitor policy for COVID patients, and with exception of rare circumstances on a case-by-case basis where it's felt that for psychosocial reasons or end of life or other circumstances that we do need to allow a visitor. We work closely with the family physician and the caregiver team there to consider those requests on a case-by-case basis.
Right. So just to reiterate, the COVID floor is allowing visitors on a case-by-case basis. When it comes to end of life, is it one visitor like per day? Is it just the same visitor the whole period of time? How's that working?
Well, for the COVID floor specifically?
Yes, sir.
Yeah, Megan, again, that's entirely a case-by-case circumstance, and it is the rare exception rather than the rule. There's not a good answer or a specific answer to your question. I'm not trying to dodge it, but I'm just, it is truly something we manage on a case-by-case basis and just try to do what is the right thing within the need to protect all involved.
And one more follow-up question. Is PPE shortage still a thing over there?
No. We've never really had a challenge with PPE thanks to the work our emergency response team had done in acquiring PPE, and as well as just the support we had from the community for donated gowns, et cetera, early on. So we're in good shape. We have an ample supply of reusable gowns, as well as disposable gowns, the N95 masks that our caregivers wear. We have adequate inventory, and eye protection as well.
Very good. So if PPE is not a shortage, then I'm somewhat conflicted on why COVID floor visiting is still as prohibitive as it is. Does PPE is it ever given out to visitors who come in?
Sure, we require them to wear a mask also. It has to do with when a visitor comes to the hospital, although they may screen negative in terms of the screening questions and the temperature check, right? But they still could be an asymptomatic carrier, and oftentimes it's difficult to have full compliance with PPE requirements. For example, when I'm wearing a mask and I need to sneeze or cough, I often want to remove my mask so as to not soil my mask. So it's that reason, and it's also just to protect the individual, the individual community member from potential exposure up on the COVID floor, where we know we have a COVID positive patient population. It's really, we believe, erring on the side of caution and using an abundance of caution to protect all involved.
Very good. Well, Jeff Bourgeois, again, we always appreciate your being with us on this program. And again, we will talk with you as conditions warrant moving forward. But we're so glad that numbers are maybe coming down and will stay down there at the hospital. But again, our big thanks to you and the entire staff at San Juan Regional Medical Center, those first responders who are really the front lines of this fight as we see these numbers getting better for our entire community. So once again, thank you very much for joining us this morning.
My pleasure. Y'all have a wonderful day.
You too.
All right, you too very much. That's Jeff Bourgeois, President and CEO of San Juan Regional Medical Center, joining us this morning on our COVID-19 program. And we appreciate that very much.
Of course.
Yeah, so good information and a lot of new things. You know, the visitor policy has changed. I know that is very difficult for a lot of families who had to deal with that during the very strictest of times because of the numbers of patients that they were dealing with there.
Yeah.
So, and you saw that too in your other job as chaplain for Basin Home Health.
Yeah.
So, and Basin
it's really
Home Companies.
quite a rough thing to figure out.
Right. Exactly. Understood. A lot of tough decisions being made. I think we can all agree on that. Mm-hmm. Yeah. Let's talk about some of the numbers. Again, San Juan County is tracking some of the COVID-19 cases, and these are the latest numbers from the 2-week averages. So these are the averages, the graphs that come out. These come out yesterday. Some days they come out on Thursday, like after we're off the air. This week they came out Wednesday before we came on the air. So
good luck for us. That's
so go
good.
figure. Yeah, well, that's why they're on the show. So we have them here. You can certainly see that magenta line of New Mexico cases that is coming down. The blue San Juan County line that is coming down. The green Navajo Nation line of cases that is coming down. You know, all trending in the right direction.
Right. Yeah. Look at that delightful plummet there.
Right. We're happy to see that. If we look a little closer, these are, again, the San Juan County cases in yellow, kind of hard to see, but you can kind of see the numbers. And then the San Juan County deaths, and then the cases per day goal, which is kind of that whole reopening conversation about moving from red to yellow to green. That's that straight red line. And the yellow line's getting close to that red line. Mm-hmm. And so, we're excited about that. And again, still heading in the right direction. I think that red line would get us to green, actually, if the yellow line gets below the red line. Mm-hmm. That is green. Yellow's a little bit higher than that. But anyway, that's where things are looking. So we're excited about that.
Yes.
And still going in the right direction. And kudos to everyone in the county who was working to drive these numbers down and wear masks and social distance and washing hands and all those different things. So we really appreciate that. From the state, yesterday, the number of new COVID-19 cases, 281, for a total now since last March of 181,332. Of those numbers, there were 22 new cases reported yesterday in San Juan County for 13,378. 12 additional deaths in our state for 3,562. One of those in San Juan County, so we're now at 410. And the recoveries were up by another 1,557 for a total of 125,064 recoveries in New Mexico. So
very good.
All things that we want to see. Those numbers are coming down. I remember there wasn't too long ago when we were talking about new cases in the thousands.
Yeah.
In New Mexico. So we're excited about that. Again, the KSJE.com. We are tracking some of the news stories, the Navajo Nation, and their active COVID cases. So again, from yesterday, 27 new cases across the Navajo Nation. These are lower numbers for them, of course, as well, for a total of 29,336. 2 additional deaths across the Navajo Nation for a total of 1,114. And so that's the latest numbers there. The recoveries on the Navajo Nation are 15,917. And then the third story that you can see on the screen right now is what we're going to be talking with Devin Neeley about a little bit later on this program on the red to green map and some of the math that was used, and the local government's kind of wanting the state to ask for some documentation of how they got to that number.
Yeah.
So we'll talk more about that in a little bit here. But let's talk about Johns Hopkins numbers.
Very good. So the United States confirmed cases are now at 27,828,150. The United States confirmed deaths are now trending at 490,718.
Okay. And those are coming down as well.
Yes.
Right? Because it wasn't too long ago when those numbers were astronomical.
Yes.
Seemingly
Very
so.
good word for it.
Yeah, I'm afraid so. So there you are, everybody. Let's go to our next guest.
Very good.
Shelby, who's on the phone this morning. Good morning. You're on KSJE. Thank you for calling in this morning.
Good morning. This is Sandra Ely with the New Mexico Environment Department.
Hi, Sandra Ely. Thank you for calling in. We appreciate that because we wanted to ask you a bit about the watch list, which is published by the Environment Department every day, and kind of explain a bit more about what that is tracking and how that works. So we certainly appreciate you calling in to talk to us a little bit about that this morning. And so talk to me a little bit about this watch list. You are collecting rapid response data from throughout the state and publishing it on this list every day, correct?
Yes, that's correct. The New Mexico Environment Department and other state agencies assist employers when they have positive employees in the workplace, and that's considered a rapid response when we reach out and provide that assistance. When 2 or more of those cases happen in a 2-week period, we put that facility or that business on the watch list.
Understood. And that's what's happened, of course, at businesses throughout the state. And the reason we wanted to have you on, because one of our local businesses has now been shut down because of too many, I guess, rapid responses. And that's kind of how it's determined, correct?
Yes, that's correct. And so any business that has 4 or more rapid responses within a 2-week period is notified that they've had too many, that they need to shut down, and that's the process that was taken with the Farmington Home Depot just recently.
Very good. And hi, this is Megan. Can you just explain to our listeners, I know there's always a bit of a confusion between what a rapid response is as compared to, we're not talking about 4 cases, we're talking about rapid response. So can you give us a rundown of what exactly that means?
Yeah, certainly. So a rapid response can have 1 or more cases. You can have 3 or 4 cases in a single rapid response. So the employer learns from their employee or is notified that they've had 1 or more employees that has tested positive. They're obligated under state law to report those cases to our Occupational Health and Safety Bureau, and they will initiate a rapid response. So you can have 4 rapid responses and have even more positive cases because you can have more than 1 positive case in a rapid response. The Occupational Health and Safety Bureau will then contact the employer and make sure they're following the proper procedures to prevent the spread of COVID-19. Such things as isolating the person that is positive, quarantining the close contacts, disinfecting the area. I mean, those are the procedures that need to be taken whenever you have a positive person in the workplace. So this is not an enforcement or a punitive action. This is an outreach to the employer to help them make sure that the workplace is safe. But if we continue to see a pattern, if we do see 4 or more rapid responses in a 2-week period, that's when we say, hold on, something's going on, you need to shut down and close the business until we can, for 2 weeks, and after a 2-week period, we're assuming that the location has taken care of everything with our guidance and is ready to reopen.
And that is kind of what's happened with the Home Depot store this week or last week, for example, correct?
Yeah, that's correct. They were served notice, and they're required to stay closed until February 26th. Now, there is an alternative, and we've had a number of employers take us up on this, and that is if they wanted to open sooner than that, they can sign a surveillance testing agreement. And what that requires the employer to do is to test 100% of their employees every 2 weeks. And if they do that and do the first testing initially, make sure everybody's negative, then they can send them back into work and then continue to test them over a period of time. Then they could open up sooner. So far, we haven't received a surveillance testing agreement from Home Depot. They know it's there. We have a number of businesses that have signed up, including, Walmart and Smith and Target and Costco and Albertsons. A number of facilities around the state, a number of businesses around the state have opted to sign on to these testing agreements so that they can stay open and provide these additional measures to ensure that they're providing a healthy and safe work environment.
Thank you for explaining that. And that may explain to our listeners, too, and our viewers why maybe when we see some of these businesses on the watch list and they have more than 4 rapid responses, that they were not shut down. And the reason is because they have these other agreements with the Environment Department to do that regular testing. And I'm kind of shocked that, just personally, that Home Depot did not do that as a national retailer. You would think that would be a corporate decision. As we look at the latest watch list from today, there's only 2 San Juan County locations that were shut down, the one being the Walmart Supercenter. That was back in November, which I think is one of the very earlier times before that policy was changed to start that testing agreement with these organizations, and then of course the Home Depot, which is now going to be closed and reopening on the 26th. But that's available to all businesses, correct?
It's available to essential businesses.
Essential, thank you.
We want to provide an opportunity for these essential businesses to stay open. You know, it's a way to do that so that they can, you know, sell food, have their hardware stores open, have their auto repair stores open in a way that, you know, provides a service to the public that has additional precautions to make sure that that work environment is safe.
Understood. And I guess, Sandra, as we move, San Juan County, very hopeful that we'll be moving from red to yellow and to green as other counties have in our state. These rules, though, the rapid response rules won't be changing depending on what color our county is, right? Those rules still remain the same, correct?
Yeah, that's correct. I mean, if you have one business with a number of rapid responses, there's a problem there that has to be addressed. So it doesn't change as counties move from red to yellow to green. This will remain in effect.
All right, very good. Well, we appreciate your calling in this morning to bring us that perspective and information from the Environment Department about the watch lists. Thank you very much.
Yeah, thank you. It's my pleasure. I'll call back anytime you need assistance.
I appreciate that. We will keep your number handy. Thank you very much.
All right. Bye-bye.
Bye now. Thank you. And that is our next guest this morning on KSJE, Sandra Eli from the New Mexico Environment Department. She is with the Environmental Protection Division of the New Mexico Environment Department. So we appreciate her calling in as well this morning. And we have another guest.
Yay!
I told you we had a big show.
We do.
Right?
It's a big show.
It is a packed show. So our next guest is locked and loaded, as they say, on the phones this morning. Good morning. You're on KSJE. Thank you for calling in this morning.
Hi, Scott. It's Tina.
Tina Pacheco-White from the First Tee program. Good morning.
How are you?
I am good, thank you. Thank you for calling in this morning, and I wanted to visit with you, and Megan wanted to visit with you about the First Tee program and some of your efforts to get student golfers back on the course once the snow melts.
Yes, we are excited to see the sunshine today, I'll tell you that.
That'll help, right? Definitely.
That's right.
You're starting up some junior golf leagues, right?
Yes, we are. We are starting programming next week. We're starting on Wednesday with a girls' league at Civitan Golf Course. Then we'll have a junior league out at Riverview. And then we're really excited on the 24th, we'll start our middle school and high school league. This is an opportunity for those kids to be in a little bit more of a competitive atmosphere. They play a different format every single week. And through our partnership with San Juan County, we're able to offer that at $3 a round. So those kids can play one day, they can play 5 days, however many rounds they're able to attend. But just giving them a chance to get out, get their clubs out. If they're new to the game, we'll have support there. But we're ready to go. We ran programs through the end of November last year, and we've got stuff ready to go as soon as the weather lets us do it.
Very good. $3 is a steal. I've played full price golf before. That's a good price. Let's go to
You should pay more when you play golf. I've seen you play golf. You should pay a lot more for tearing up those courses.
I can't keep the club in my hands. So let's go back to the First Tee's mission. I want to make sure that we cover that, what you guys do, and what the purpose of in getting these kids connected to this game.
Sure. Our mission is really to provide opportunities for kids to develop life skills and character values, and golf is our tool. And what we've really learned over the past 6 or 8 months is that, kids need to be outside. Kids need social interaction. And they need, a lot of kids thrive under healthy competition, and we can provide all of that right now. Our programs have been developed to provide those things, and when many other activities for kids are hindered by the pandemic, we can move forward safely. And so we have really taken it as, just an added urgency that it is key to mental health and overall wellness that kids be outside playing, and we can help provide an opportunity for those kids. We have, a lot of support from the community where we turn no child away for any reason, but especially a financial reason. We provide equipment, and we're just really looking at, an opportunity to, if your kid is struggling and needs an activity, has never played golf before, give golf a try, because we've got everything in place to make that happen.
Exactly. And of course, conditions will be improving, as we mentioned, and so the courses will be reopening, and you'll be able to accommodate these kids, as you mentioned, Tina, with these planned activities next week, and also just having the courses open to get out there and spend some time in the fresh air and be able to do a little bit of that socialization that a lot of kids have been missing the last few months.
Sure, absolutely. And, it's been, we've changed our model a little bit to allow for that, because we used to be, really class-based, where we would have, 10, 15 kids in a class. And when we couldn't do that, we shifted that to more of a league model, so that a 4-child pod I could give this pod a tea time at 9 o'clock and this pod a tea time at 9:15. We could still get those kids out on the course, but not be in that class model. So the golf courses have been open since June, and we've been going full force ever since then. And the only thing that's holding us back right now is the snow. So I know we need the moisture.
We do, but we need to get on the golf course.
Yeah, that's right.
And if you let Megan on the course, please charge her a divot deposit.
That's right. You can cover a few more kids with my divot deposit.
That's right.
Tina Pacheco-White, always a pleasure to have you on. Thanks so much.
Yes, thank you, guys.
Thank you very much.
Four Corners, firsttee4corners.org.
Thank you. There you go, everybody. There it is, the First Tee program. And a great opportunity. Again, I know a lot of kids are chomping at the bit to get out and do something.
So important.
So First Tee is there, which we appreciate.
And this is a great socialization activity, not just because she's right, it's a great game, it teaches discipline, it's all sorts of things, but also you don't have to be anywhere near people when you play golf.
That's true.
So,
and where my ball lands, I'm usually not near anyone.
Yeah, when you have to put on your scuba gear and go look for it.
Exactly. But a great opportunity and a great program. Can't say enough about First Tee. It's wonderful. So there you go.
There you go.
And now we have another guest. How about that? Look at that. It's back-to-back guests this morning on KSJE. Good morning. You're on KSJE. Again, thank you for calling in this morning.
Good morning, Scott and Megan. It's Devin Neeley from San Juan County.
Devin Neeley is back with us from San Juan County. Thank you for calling in, Devin Neeley. We wanted to ask you, and I mentioned it on the 8 o'clock show, but if folks weren't with me and us, because you were my guest earlier this morning at 8, I asked you briefly about and I love to call it the COVID Mapgate scandal. And that was the, again, idea that San Juan County was within 5.001% of moving from red to yellow last Wednesday when the new map came out. And so San Juan County and the city of Farmington have asked the state for some clarity on how that number was calculated. And I guess I'll let you take it from there, Devin Neeley, if you wouldn't mind.
Yeah, correct. That public records request went in Thursday of last week, so I guess that was the 11th. We received a response that day within the 72 hours required by law to respond to any IPRA request, and that request was forwarded not only to, we sent it to Department of Health, they forwarded it to, I guess the HSD department, Human Services Department, as well as another individual. And then we received another response this week saying that the request was forwarded to the governor's office, but that request would not be filled before February 26th. So unfortunately, our questions have gone unanswered, and we had hoped to move the needle and possibly get the governor to give us a little bit of leeway, 0.01% leeway, in fact, but That doesn't seem to be the case, and now we anxiously await this coming Wednesday when the numbers will be updated once again, and we'll see if we're any closer to the green tier, the yellow tier, or whatever that may be. We've already seen great increases in improvements, rather, in our test positivity rate. We're seeing that overall cases are going down. We're not quite to the level, the case threshold, but our test positivity rate seems to be in a good place and continuing to fall.
Very good. And Devin, I wanted to ask you a bit. We mentioned last week that the test positivity rate had dropped from, it was a 12.4 and change, I think, 2 weeks prior to that 5.01 just last week. And so that's, again, great strides, I think, in the right direction. And that's, I think, what the numbers the county's looking at kind of bear as well, correct?
Yeah, absolutely. And, the numbers that we calculated based on publicly available data are even lower than that for our test positivity during that same period. But regardless, we're seeing a decrease, and we're glad to be seeing a decrease. What that means is a lot more people are being vaccinated. The COVID-safe practices are being implemented and working. People are wearing masks and limiting their travel as much as they can. And the bottom line is the virus isn't being passed around, and that's our goal here, is to keep the virus from being passed around in whatever form that takes.
Great. And so let's talk strategy real quick. I know that you're a strategy fan with all of your risk game playing. But so it's a very complex thing, of course, because testing is a snapshot in time, right? So, but when we're talking about moving to green, is the county suggesting that people just go out and test it en masse, and that might yield more negative tests, which might get us into green?
Maybe not in so many words.
Well, you know me, I'm always choosing so many words.
Many words.
If you have symptoms, absolutely go get tested. If you have been in a situation where you may have been exposed, absolutely get tested. If you just want some peace of mind, absolutely go get tested. And it's free and it's quick. It literally takes 20 seconds to perform the test. And they're at a pretty central location at McGee Park right now for testing, and so there's no reason not to. It sounds like gaming the system, but the bottom line is the more tests we have, the better test positivity rate we're going to have, because the number of cases are falling as it is. So while I am not telling everybody, no matter what, to go get tested, there are criteria in play that almost everyone falls into. If you've been in contact with someone who's been in contact with 300 other people and you have no idea, it sure couldn't hurt to get a test.
Very good. But Devin, I know the governor's mentioned the same thing, though, hasn't she, in some of her public remarks about, making yourselves available at these free testing opportunities throughout the state. They are free to all New Mexico residents. And so I think she's mentioned that as well, hasn't she?
Absolutely. Coming from the governor and the state and the health department, the bottom line is get tested. The bottom line is absolutely get tested, and there is nothing to prevent anyone from getting tested. Transportation may be an issue for some folks, but if you can find a way, get a test and get there and get tested. That includes if you've had the vaccine, because the vaccine isn't 100% preventative. It's still 98% preventative or something, so there is a chance. So even if you have been vaccinated, it's valuable to be tested continually, and that way you have a baseline. And personally, for me, my grandmother's 99 years old, and if I was the vector, if I was the one that got her sick, that would weigh heavily on me. I don't want to spread the coronavirus to any of my friends or family. It can have a tiny mortality rate, and I don't care. I don't want these people in my life sick, and so for me, I test regularly just to make sure, and there's no harm in that. And I would hope that others care enough for their family, their friends, and their community that they would do the same.
Well, that's a good point, and I appreciate that. And the other part, too, is I think that folks can be asymptomatic, so you could still be spreading the virus and not know that you're sick or not feel that you're sick, and that test, I guess, would confirm whether or not you are, and obviously if you're positive, you could take precautions not to be spreading it around, and that's another important thing. So the other thing I want to mention,
that's the whole reason.
yeah,
For
and
testing. Yeah.
and there are testing at home kits too that folks can order in New Mexico that are free to order, and you can test yourself in the privacy of your own home. So there's that option as well.
Right. And so, Devin, Neeley, it's always a pleasure to have you on, and 2 times in one day is
How about
a
that?
double pleasure.
Right?
The pleasure is all mine. I appreciate you both for the good work on this show and keeping it up, guys. Have a good one.
All right, Devin, thank you very much. It's Devin Neeley. He is the Public Relations Manager with San Juan County, our guest this morning here on KSJE. So, great guests.
Great. It's
Look at
a
that.
powerhouse of guests
Right?
today.
A bunch of guests
I know,
today,
and look at all the variety
Lots
of
of
topics
information.
we covered.
Definitely. We had a few more little things to pass
Yes.
along about, speaking of
And
testing.
then I have a little tidbit of a story.
Do you? Mm-hmm. Is it including llamas?
No, gosh, they just disappeared off the map.
They kind of did, didn't they? Anyway, as Devin was mentioning, the testing has moved to McGee Park. It is available. We just want to remind everyone, Monday through Friday, 8 to 3, 8 to 2 on Saturdays. And again, you can register before you get there at curative.com. Curative has taken over the COVID testing now that the state health department has kind of moved into the vaccination phase of things. And so that's what's going on with testing. So we always like to share that information on this program for everyone. And then, of course, to remind everyone that we are still in phase 1B of the COVID vaccinations, which are being rolled out. And we've seen, a lot of major vaccinating events going on. Wednesdays and Thursdays here at San Juan College, there's a big vaccination clinic that happens. I know, Megan, you've been a part of that.
I have.
And have seen firsthand how many folks they just get through that
It's
very efficiently.
highly efficient.
Right.
Highly. And so that's a shout out to Rita, is the head honcho there.
New Mexico Health Department, right?
Yes.
Yeah.
So
Very good. Well, good going, everyone. And so, again, we will keep you up to date on some of those opportunities. But again, the idea is you have to get registered in order to get on the list when the vaccine becomes available. So as the supplies of vaccine increase, decrease, depending on, where the supplies are coming from, that's what the state is using, that registration at vaccinenm.org to get everyone on there. You can put in your birthday, any health conditions you may have, any insurance information, and that's where the state is then being able to go and contact you to say, hey, we have a vaccine for you. Here, let's make an appointment and get you in.
yes.
That's how it works.
Yeah.
And if you have difficulties, there's a phone number, again, 855-600-6453. Again,
855-600-3453.
thank you. Sorry.
Usually I'm not the one that's able to correct on numbers. So
I
I'm
know.
impressed. I still can't remember our station number.
Right. But thank you for catching that. 855-600-3453 for our radio audience. If you don't have access to the internet or you need help to register or something went wrong, you can call that number. They will get you signed up.
Very good.
So that's another great thing.
It's a wonderful thing.
Yeah. So then we want to get everyone who wants a vaccine to get a vaccine, to be
Yes.
able to get one. So
Yes.
there you are. What's your story?
Okay, so
What is your story?
What? Yeah, everybody's been asking that for my
years,
whole life.
I
Yeah.
know.
So the WHO, not of Pete Townsend fame,
Okay.
but the World Health Organization, recently sent a group over to China to investigate further the origins. It's always, of course, if we know the origins of epidemics or pandemics, as it were, the more likely we are to prevent them in the future. And there's been tons of hypotheses out there. We have the controversial one about the accidental lab spillage.
Right, yes.
And then of course we haven't heard of pangolins in a while, but then I saw something this morning about badgers and rabbits. And so, categorically speaking, just stick to the classic meats. But anyway, the point of this is they sent a group over there. They discovered a bit more detail. They still weren't able to nail down exactly what occurred. The common theory is it began in animals, it spread to humans, but that's pretty actually consistent with most of these. I know, the original SARS and MERS, that was the same thing.
Right, sure.
Swine flu, bird flu, all that. So, but I thought what was most interesting about this article, and this came from Wired magazine, was that there's a lot of talk over, well, maybe the premise of the WHO is a little shaky because they can only investigate according to the country's own rules. So they have to be granted access into the country, and then the country dictates in what way this investigation goes down. So there's a lot of talk about how that whole thing has to be revamped because, if you're a country that's maybe a little skittish about revealing certain facts, they might not grant access, appropriate access. So there's a big push right now to basically categorically say, hey, if something's going on, if there's an epidemic going on and it has international implications, you have got to let us in. Of course, they do this with all sorts of things, nuclear weapons, chemical warfare. Both of those right. topics have an international agreement where we don't really care what your country says. We're going in there because we suspect there's something going on. So I thought that was really fascinating. I didn't know about that, but it seems like that's a significant flaw in investigation if you're relying on a country or a society to put up their own rules in
sure.
that way. So,
well, a lot of this is all about trust, isn't it?
Yes, and there's a lot of untrustworthy players out there in the world. I'll say that.
That's true. So, interesting. Well, thank you for sharing that.
Yeah.
So there you go,
Little
everybody.
Research for you.
Exactly. There you go. Well, that has brought us to the end of our show today.
Yeah, great show.
How about that? Lots of good information.
Yeah.
So we thank everyone for joining us. Again, the information is available, again, on demand. You can go to our Facebook page, our YouTube channel, and watch it, share it with other folks in your networks to share this information as well. And we'll be back next Thursday. 9 o'clock.
That's right.
Right here.
And we'll see you on week 50. But also I think we should plug, if you yourself feel like you have something to share, let us know. You can be a guest.
Oh.
Right?
Okay.
If there's something.
Sure. Reach out.
Reach out.
There you go, everybody. We'd love to talk to you. So there you are. But thank you for joining us, everyone. Stay well and stay safe. And we will see you next Thursday right here on KSJE. Bye-bye.